Hello, I'm Dr. Cox. I'm the Associate Program Director here at the Aurora Sinai OBGYN program, and I'm joined today by some of our resident doctors, and we're going to talk about our program and a little bit about Milwaukee and a little bit about ourselves.
My name is Catherine. I was born in Venezuela. I moved to Miami when I was 13. I went to undergrad in Miami. Then I moved to Michigan for medical school, and I'm here. And I'm a third year.
I'm Laurel Peterzak. I'm one of the first-year residents. I'm originally from Minnesota. I went to undergrad in Kenosha, Wisconsin, then went to med school at Des Moines University, and now I'm back in Wisconsin here.
I'm Namisha. I'm a third-year resident. I was born in India, but grew up mostly in Indiana. I went to college at Indiana University Bloomington, and then went to med school in Indianapolis at Indiana University, and then I moved here for residency.
And I'm Callie. I went to Des Moines University for medical school as well, and then I came here for residency, and then I had an active duty commitment, so I was in the U.S. Air Force down in San Antonio for a couple years, and then I came back as faculty. Well, it's great to have everybody here. Let's get started. What was one of the top things that made you interested in this program?
So one of the things that I was looking for is something that a program that would train me and everything to be like ready when I was gonna be on my own. And I thought that they had like high OB risk here. Also, even though like we're in the Midwest, there's a program that still like treats and like takes care of like the Hispanic community, which is something that I really want to do because I'm originally from Venezuela. And something that might sound like silly, but when I saw the Instagram page, it looked like everyone was like dancing and like more like a family, and I love dancing, so that's why I came.
Yeah. Okay.
Yeah, I definitely wanted a program that like prepared us to be good generalists because I didn't know if I wanted to subspecialize or not. The other thing that really stood out to me was during the meet and greet, everyone knew each other. Everyone knew each other's like spouses and kids and pets, and were asking about it. I knew I wanted to, leave Indiana for a bit, but I wanted to be somewhere where I was going to be like well supported and feel like family.
Yeah, and a big part of me was coming to this program was the relationships between the residents and the attendings. I did 4 weeks here during my fourth year of medical school, and you guys just seemed like to have so much fun with each other. And I had such a positive teaching relationship, but also personal relationship between the residents themselves and then the residents with the attendings.
Mm-hmm. I think one of the important things that I really find valuable about being here is that collegiality that we have. Like, we really want the residents to have such a great experience and have wellness, and we want the faculty to have the same thing. So that was one of the reasons that like drew me back to working here. Okay, tell me a little bit about what the OB experience has been like as an intern, Laurel.
It's been good so far. I just started on labor and delivery. It's busy, but there's lots of different patients, high acuity, so there's so much to learn. When you're on labor and delivery, starting out as an intern, you're with another second-year resident and then a senior resident, and so you work together as a team to co-manage patients with the attending as well. So you get to be on a lot of deliveries, you start learning how to do C-sections, really improving and learning how to do procedural skills as well in labor delivery. I've also done a month on the gyne surgery rotation as well, where you start really developing those surgical skills in the OR. I think from day one, I was able to be primary in the OR, working with an attending. Also having a senior resident there be by my side to teach me and learn through the way, but I felt like from start to finish, I was really involved with the patient care.
I think because we do so much high risk like out the gate, it makes you very comfortable by the time you're a senior. Like, yes, I know how to manage these really high risk problems, and I know what to do even without needing to ask the attending. But the other great thing is that the attendings and the hospitalists are always there for help when you need it. They're just a phone call away and really willing to help.
Right. And one of the great things about working at Sinai is that we're the referral center for the area. So we are really fortunate in seeing a lot of acuity and high-risk patients, and having that relationship with maternal fetal medicine is great. And on the flip side, we also get to have a really great relationship with our nurse midwives. All of our graduates hit all of the numbers that they need for any surgical procedure. But let's really talk about like what is gynecologic surgery like at Sinai?
So we started first year. We do minors as a second year, like we talked about before. We can, when we have our clinic, we can get our own surgeries that we can schedule, and we can start doing even majors as like second year. As a second year, I had my month of clinic, which was great because I got like 6 vaginal hysterectomies with Dr. Cox.
We were in the OR.
And so I started doing hysterectomies as a second year. We also, as a second year, do gynonc, which we get to like experience, like do like major surgeries too there. As a third year, you are more like you get to do all the majors, and we also get to do more outside rotations. Like we go to West Dallas, which is another part of our hospital, and we go to Urogyn, and we go back to gynonc, which we get all exposure to surgery again. And we get to, and another good thing that I like is that we get to operate with other people, so you get to learn more, not just the attendings that we work here with, which are great, but you get to like learn little tricks that other people have, and then you get to be your own person at one point.
And robotic certification is available for our residents. Yeah. It's not a requirement, but you can get it. And do you feel like you're getting enough robotic cases to meet the criteria so far?
Yeah, definitely. I had my first month of gyne recently, and I did, probably like 5 or 6 robot cases. And even as a second year, like they would help like start me by like taking tubes, just so you can get used to like the feel of the robot and what that's like. I think our program does a really great job of, starting you as interns with like manipulating and being the bedside assist, and then like learning to dock the robots. And then as you get towards the end of your second year, you start doing a little bit more of actually being on the robot.
Mm-hmm. And we do some simulation too to make sure that our residents are feeling confident and comfortable when they enter into our operating rooms.
We do simulations for almost everything, I feel like, any procedure we do. So we do it for C-sections, we do it for hysterectomies, hysteroscopies.
Laparoscopic.
Yeah,
laparoscopic, our big one. Mm-hmm. Yeah.
And then the B floor, we do a lot of like drills where we get to like do cases of like if we get a shoulder dystocia, if we have
postpartum hemorrhage.
Yeah.
Mm-hmm.
So those are the drills.
Excellent. You mentioned a little bit that we go other places for different rotations. So can you talk about which hospitals we go to in the city and like how far away are those?
So we will go to West Dallas. That's from our main hospital. It's like 12 minutes. St. Luke's, it's also like 12 minutes from here. They're both very
convenient,
very close. And from each other, they're also 12 minutes.
Yeah,
St.
it's like a little triangle.
And in West Dallas, we do surgery, and as a second year, you go for REI. As a first year, you go for endocrine, because we do a month with them. And as a third year, you go to West Dallas and St. Luke's too. And we go sometimes to Green Bay.
Yes, sometimes to Green Bay. So we do REI up in Green Bay as well. 2 weeks there.
I think at Sinai we work with a lot of high-risk populations who don't always, get regular care, and they drop in and out. Whereas out in like more suburban areas, they're lower risk. They're usually getting routine care. And so, those surgeries end up looking different too, because some of the people at Sinai have gone undiagnosed for a long time. And then the people, out in the suburbs usually are diagnosed pretty quickly. And so those surgeries tend to be, a little bit easier, which is nice when you're learning, for sure.
So our patient population is primarily Black, and then we do have a really large refugee patient population as well. So unfortunately, there's a lot of struggles in our neighborhoods that surround us that inhibit them from accessing care routinely. So we have some things that are set up within our system that are helpful.
Yeah, absolutely. So a lot of the patients we see in clinic, as you mentioned, really are diverse, high risk, low income, low socioeconomic. Having social work in clinic has been so helpful. They're there every day for us to message, to call. They can be there even in clinic that day. if they're not working from home, to come and see the patient as well. A lot of times patients that I've had seen in clinic have issues with transportation, have issues with their home life and having a stable place to sleep and to stay. And so they're very helpful at reaching out to different community resources to help these patients.
I think being a graduate from this program and then going away for a little while and coming back, I definitely felt like I was well prepared to take care of just about anything when I left, which was different from some of my other colleagues that started at my new institution at the same time. So I was really grateful for the volume of patients and the interesting things that we see and for the surgical experience that we have. I think it set me up for fairly good success. Well, let's talk a little bit about you guys and your relationships together and how the residents interact with each other, because I think that's the biggest thing about choosing a residency program is how are you going to fit in? How do they treat each other? So talk to me a little bit about what it's been like for the first couple months integrating into the group.
I think all of us feel, like very close to each other because we're, a smaller program. Nobody else really knows what you're going through except for your co-residents. And so we definitely lean on each other a lot for support. But we also like hanging out with each other. We do a lot of, Kathy can probably talk to us about wellness a little bit. We do lots of fun things for our wellness.
We do have a wellness committee. We do different events where all our residents are blocked, like our time. And we have, like I said, we have the midwives that are attendings cover for us that time, and we do different activities. I like to do competitive activities. So we did the game ones that we did, that was fun. We also go like tubing. One time we did like a smashing thing, that was really fun too. So we just try to do like fun stuff, and we always do brunch.
Okay, so it's hard when you have to leave your family and come, to a new location and a new place. So what has it been like for you all to come to Milwaukee, especially from the south, Kathy, coming up to the snow? What's it been like for you?
I was actually pretty surprised by Milwaukee. I think it has a great diversity as a city itself. I love to eat, so there's so many restaurants. They even have Venezuelan restaurants here, which I was so happy about. I think that there's a lot of diversity. There's a lot of Hispanic population, which I love because that's who I am. So yeah, I think it's great. I think Milwaukee it really surprised me.
Yeah, for me, coming from Indiana to Milwaukee, that's pretty similar in terms of size and the feel for the city. I love being on the lake. It's, just really nice to be able to take walks by the lake and everything. I moved up here with just my dog, and so I also love how dog-friendly Milwaukee is. I can bring him all the time in the summer to random restaurants and things. There are doggy ice cream bars and doggy bars, and so yeah, that was some of the things.
Yeah, and I'm coming from Minnesota, a small town, but the size of Milwaukee wasn't too big of a city for me. So it feels cozy, but also you get that city life, which I really like. Mm-hmm. And I feel like in Milwaukee, there's always festivals going on. There's always weekend activities, so there's something for everyone.
Mm-hmm. And for family, because I think I'm the only one out of us that's got the kids. But it's been a good experience for the little kids. There's lots of parks. There's lots of places to be outside. There's definitely a lot of activities to do. And childcare isn't too terribly difficult to obtain, which is not the case for a lot of places. Okay. Well, we're going to transition now into talking a little bit more about what your clinics are like and some of the interesting opportunities that you have through Sinai to be able to interact with different patient populations. So can you tell us a little bit about how resident clinic works?
Yeah, so depending on what rotation you're on, you're usually blocked off for a half day each week, where you start off with 4 patients as an intern, and that increases as you progress through your residency, and then you are responsible for whatever they're coming in for. So it's really great because, we try to schedule interns with OB checks just to get used to normal OB care. And then you kind of progress into, more complicated things as you go through residency, things like pelvic pain, abnormal uterine bleeding, and fertility. But one of the great things is that we see all sorts of people, like we've talked about, a lot of diverse communities in Milwaukee. We also see a lot of LGBTQ patients, which has been really great. A lot of our attendings are very passionate about providing equitable care to everyone. Dr. Forgy does, a lot, takes care of a lot of trans patients. We have Dr. Behrens now, who's opening a new clinic over at West Dallas that's going to help a lot of these patients as well.
Mm-hmm. Yeah. And then tell me a little bit about abortion care and how we've integrated that into our education.
So when I started back 3 years ago, we used to have during our clinic month, we would go to Planned Parenthood here in Milwaukee, and we would go like 3 days a week, and we would get abortion care. We would spend the entire day there, which is we also did it in our hospital for when it was mandatory, but it's different because here we usually do it in the ward when the patient is either asleep. In Planned Parenthood, the patients are usually awake, which gives you the two difference, and you get to learn how to work in the two different situations.
So at Aurora, we don't do elective terminations. So any elective terminations that we saw would have been at Planned Parenthood, but we do medically indicated terminations here, or fetal demises. So I feel like we got a good range of it until the ruling changed, and then we saw a little bit less. But the program's been really great at trying to get us opportunities. One of our co-residents is at Minnesota Planned Parenthood right now, so that we can get that exposure and know how to take care of these patients.
Yeah. Our goal as a Ryan program has always been that our abortion training is opt-out. So we anticipate that every resident would be participating unless they opt out. And we really try to make sure that everyone has the opportunity to gain the knowledge to be able to provide that care for our patients. Okay, so we really value resident education, and you're blocked a half day every week for resident education. And we do a lot of different things. What are some of your favorite things that we've done in resident education recently?
I think doing simulations and drills is always fun. I'm definitely not a very good auditory learner. I do a lot better with hands-on, which I think is similar for a lot of us because we're surgeons. So I think that's always great, being able to walk through it in person together and walk through the steps, and we get all of the actual instruments out and everything. So getting used to that.
Yes, and we do gynecology sims, and then we also do obstetrics sims, and then we do office simulations. So those are kind of our three buckets. And for gynecology, we simulate all the different ways to do a hysterectomy and then also hysteroscopy. And then for OB, we do our drills on kind of a recurrent monthly basis, and it's a surprise which one it's going to be. But that's done up in labor and delivery with the whole team to help that team dynamic as well. Okay. What are some of the things that you have found surprising about being in this program that you think are really great assets that maybe you can't figure out if you just looked it up on the website?
I think coming to a community program, I wasn't sure what kind of research support there was going to be, but we have a great research institute here. If your research project can be anything from a smaller QI project, if you're not as interested in research, to a bigger project that might be a little more time intensive if you're interested in that. But there's great we have research analytics support. They'll pull data for you. We have mentors who are well versed in research and kind of can help guide you through the process. So I was pleasantly surprised by that.
I think one of the things that surprised me about the program is how we can get close to our attendings and how supportive they are, and how you can text them at almost any time, and they will always
within reason,
and they will be there to help you. Also, I think when you really like something specific, there's always someone that would like that too, and then you can always talk to the attending and be oh, I'm really interested in infertility, so you can talk about that. even with each other. Like sometimes I like infertility a lot, so some people don't. So like we're like, oh, you have that patient, oh, I would change it and then I will give you something you like. So we're always like trying to help each other, and I think that's something that I really liked about this program.
I think one thing I really liked or what surprised me is how quick we can jump in with patient care and getting hands-on. We do, as an intern, a month of orientation. We do a week on the gyne service, a week on labor and delivery, and then a week in clinic, just kind of figuring out the day-to-day. But then once you start day one on your first rotation, you just get thrown in with patient care, which I love.
Mm-hmm. One of the things as a faculty that I think is really unique and awesome is how supportive the faculty are too. And we do a lot of the same things, and I hope model a lot of those same things for you. We each kind of have our own special things that we like. Like I like vaginal hysterectomies, Dr. Salvo likes robotic surgery, so we just trade patients occasionally. So I think it really helps make it a collegial environment because we're not ever trying to like go after anything else, right? We all want to lift each other up and make sure that we're getting to everything that we want to do with our careers. One of the things that's really great about being here too is that we do have all of those options. Yeah. So you guys have started doing the Assessa procedure, which is pretty new for fibroid care. We are a referral center for a lot of obstetrics and gynecology care. So we can offer here all of the different routes of hysterectomy and all of the different treatment modalities for fibroids. And then we also are the referral center for placental spectrum disorders. So we see a lot of accreta.
I think another thing that's really great about our program is that we're, really great at trying to be in on new technology, new like procedures and things. So like we were one of the first one in Wisconsin to do the Assessa procedure a couple years ago, and now several of our attendings are doing them. We adopted like the JADA pretty quickly when that came out, which I know a lot of other residency programs, when I talk to my other friends, haven't been using that. So I think it's just really great that we get, we're very motivated to pursue those new changes in the field.
I think we are definitely evidence-based creatures here, so that we try to make sure that we're doing the things that are in the best interest, that are backed up by evidence, and offer our patients all of the options that they should really have so that they can be partners in their care. One of the big transitions in medicine is going from being a medical student to a resident. What is a piece of advice that you would have to applicants as they're applying to residency?
For me, I think it was just looking for somewhere that would support me. It's a huge transition. You're going from doing a lot of studying to doing a lot of working. You may be far from family, and so you just want to be somewhere where people are going to support you and each other, and be able to help you when you need it.
Biggest advice I'd like to tell myself or future residents applying is figure out what type of resident or physician you want to be in the future. I want to be an OB generalist, so really looking at programs where you can have an education that's well-rounded, so when you come out of residency, you feel ready for that. And I also wanted a community program somewhere that was a little bit smaller where you could get close, and so definitely figure out what type of physician you want to be in the future and look at programs that will fit for that.
I think for me, it's more like I would say that you have to look for a program that has things that you're interested in. So I know that here we do a lot of education. We have medical students that we have to teach all the time. We have to, as a senior, you have to teach your juniors. Even as a junior, if you're a second year, you teach your first year. We do a lot of education even during our morning rounds. So that's something that I really like, because I have a background in education. Something else that I would recommend to look for is somewhere that you can fit in as a person with your personality, because that's very important. It's gonna be hard. so having that people that are like you, think like you, but they're also different, but we all complement each other.
Mm-hmm. I think the biggest piece of advice that I can give is have an open mind. The training is going to be pretty similar between the places that you're applying, right? Like we're all accredited by the ACGME. We all have to do the certain things that are the same. So you're right. You want to look for those very specific points that are important to you. So if care in different patient populations is really important, like LGBTQ or termination care, those are things that we excel at, and we really excel at providing underserved care to our patients as well for our underserved patient population. So I think matching what you are looking for in your programs is going to be super important, and just having an open mind about location, because you don't actually get to decide. It's a match. Well, thank you all so much for taking some time out of your busy schedules to come and talk about the program and your experiences. It's really valuable to be able to let our potential candidates know that. We really hope that you have a wonderful interview season, and best of luck.